So this last little part, apologize for that. I got a phone call I had to answer, but only a few more slides in this chapter, and we were talking about death and dying, and one thing here is again, don't be afraid to express empathy. Don't be afraid to, you know, ask the tough questions, but make sure that all your statements are positive without giving false hope, like, oh, it's going to be okay. Well, you know what? It's not going to be okay sometimes. And sometimes it's better, to have neighbors come over. Is there anybody I can call for you? Is there anything that I can do? And you'd be surprised. People start asking, can I make you breakfast? Can I do this? They want to stay busy. They want to be busy, and let them help. This is very unexpected. They didn't wake up this morning expecting for this to happen. The CISD, Critical Incident Stress Debriefing, is a way that EMRs can use counseling to deal with the stresses of providing emergency care. So signs and symptoms of emergency stress, you have to recognize this in yourself as well as your partners, as people that you work with. But if you find yourself kind of withdrawing from normal activities, especially with friends and family, you just don't feel like doing things, you're having a hard time sleeping, weight gain or weight loss, or you try to deal with it with alcohol or drug abuse, all of a sudden you don't get along. We can talk about the divorce rate with people in emergency services and, fire, police, EMS, and it is high because, sometimes we'd rather be at work than deal with stuff at home. At least at work we feel purposeful, we feel needed, and we go home and like, you're never here. And so that all kind of compounds with our own internal stress that we have. Lack of interest in things that you used to enjoy doing. So CISD brings rescuers with a trained person to talk about things that happen. So usually after a critical incident, a school bus, full of kids gets careened by an 18-wheeler, and there's a lot of kids injured that you go to, and you get flashbacks of, oh, that little girl that we couldn't save. And so this is a trained person that comes in with your peers, and you get to talk about it. And this is best if it's done within 72 hours of the event. Anything later than that just drags it out. So only a small percent of the patients that you have will be mentally disturbed. But there are people that have emotional crisis from just little and big things that flare up within their life. A behavioral emergency is something that's unacceptable behavior that's not tolerated by others. So 5 major factors that cause behavioral crisis can be in any of these, including medical conditions that have a treatment for this. Emotional phases that we talk about include the high anxiety or emotional shock, denial, anger, and that remorse or grief. Your role as an EMR is to take care of not only physical but also emotional care of your patients. So a big thing that we do is communicate with them, listen to what their needs are. And there are times when you can transport a patient against their will. Just make sure you call law enforcement, make sure we're both on the same page with this, and then you will be less likely to be accused of false imprisonment or kidnapping. So behavioral emergencies are situations in which a person exhibits abnormal behavior that is deemed unacceptable by others. Boy, that's just right out of the book. I like that one. Mild to moderate depression over a long period of time. It's not really the definition. It could be close, right? But not the definition. Anger that is justified by the situation. Not even. Strange behavior but is otherwise mentally stable. Boy, these are all tough, right? But right out of the book was that top one, abnormal behavior that is deemed unacceptable by others. Which of the following is not considered an emotional phase in the emergency crisis? We talked about anger, we talked about denial, we talked about grief. We did not talk about violence, so that was one that doesn't fit in there. When treating a patient with PTSD, one of your responsibilities is to protect the patient from harm. That's always our responsibility. So I like that one. Speak with the patient in an authoritative, forceful way. I like authoritative, commanding. You give them choices, but you stay square in what you believe in. But forceful, I don't know about. Convince the patient to take care of the problem. If he could take care of the problem himself, it wouldn't be calling you, right? Contact law enforcement immediately. That's a good one, but the biggest thing is to protect the patient from harm. And that wraps up the behavioral emergencies chapter here and wraps up the rest of our medical emergency.